Diuretics are drugs that increase urine and solute excretion from the kidneys. I will take you through the loop diuretics, also known as high efficacy. Examples are furosemide, also known as Lasix, bumetanide, also known as Bumex, pyretanide, and the rest. Their mode of action is they block sodium, potassium, and chloride reabsorption from the ascending loop of Henle. Indications: they are indicated to remove excess fluid. So they are indicated to persons with hypertension, pulmonary edema, peripheral edema, nephrotic syndrome, ascites associated with cirrhosis, forced diuretics, like when you have taken poison and you want to excrete the poison. You can also take the loop diuretics. And then congestive cardiac failure. Their side effects are dehydration. Since you will pass a lot of urine, you can have dehydration, then hypotension, hyperuricemia, ototoxicity, especially furosemide when you give it rapidly. Okay, when you administer furosemide IV rapidly, it will cause ototoxicity. We have muscle cramps due to hypokalemia, electrolyte imbalance like hyponatremia, hypocalcemia, hypomagnesemia, and all those electrolyte imbalances. Then we have, it can cause allergic reaction and fatigue. Nursing considerations: do not administer medication if potassium level is below 3.5. So you all know potassium levels, the normal, are supposed to be 3.5 to 5.0. So if it's 3.5, below 3.5, you should not administer loop diuretics. And then you monitor the weight, the body weight, like because it's the best indicator of fluid retention and fluid loss. Then you monitor intake and output. You monitor electrolyte levels closely. And then you monitor the blood pressure of the client. Since loop diuretics, they can cause low blood pressure, hypotension. And then educate the client to change positions slowly to minimize dizziness and prevent falls. There is a caution there when you are administering the loop diuretics. Administer medication in the morning to prevent nocturia. Nocturia is excessive passing of urine at night. So you don't want to disturb your patient by going outside to pass urine all the time. So you administer during the morning, in the morning I mean, so that they can pass the urine during the day, like when they're not sleeping. It doesn't have to interrupt their sleep patterns. And then always administer IV furosemide slowly over 1 to 2 minutes, because rapid administration can cause hearing loss. That is ototoxicity. And then do not administer furosemide IV faster than 4 milligrams per minute.